Over the last 2 months, Bangladesh has confirmed 25 cases of anthrax, 17 in Rangpur and 8 in Gaibandha. Meanwhile, 3 people have died from anthrax-like symptoms, 2 in Rangpur and 1 in Gaibandha. The question naturally follows, is it safe to eat red meat when anthrax is suddenly spreading again? But what exactly is anthrax? Why does it raise such concerns about meat safety? And what can we do to contain it? Let's break it down in today's Star Explains. Anthrax is an infectious disease caused by the bacterium Bacillus anthracus. A related strain, Bacillus cereus biovar anthracus, can also trigger similar infections. The disease primarily affects grazing animals such as cattle, goats, and deer, but it can also infect carnivores that eat contaminated carcasses and humans who come into contact with them. The name comes from the Greek word anthracus, meaning coal, for the dark, coal-colored sores the infection leaves on the skin. But anthrax isn't new. It is one of the oldest known zoonotic diseases. Traces of it have in fact been found in Egyptian mummies. By the 18th and 19th centuries, it had become one of the most devastating livestock diseases across Europe and Asia. In 1876, Robert Koch identified Bacillus anthracus as a cause of anthrax, marking a milestone in germ theory and modern microbiology. Today, it remains a disease of both animals and humans, capable of surviving decades in soil through its hard protective spores. The first known outbreaks in Bangladesh were recorded around 2010. However, this year alone, at least 3 suspected anthrax-related deaths were reported, 2 in Rangpur, 1 in Gaibandha, while the number of confirmed cases stands at 25. Experts warn that the actual number may be higher, since many rural infections go unreported or untreated. Anthrax does not spread from person to person. You can't catch it by shaking hands or sharing the air. Infection usually occurs through contact with infected animals or contaminated meat, hides, wool, or soil. Microscopic, durable, and highly infectious, the spores can enter through cuts in the skin, the lungs, or the digestive tract. Once inside, they release toxins that spread quickly throughout the body. There are 3 main types of anthrax. Cutaneous anthrax, the most common form appearing when spores enter through skin wounds. It causes dark ulcers, swelling, and high fever. Then there's gastrointestinal anthrax, which occurs when someone eats infected meat. It can cause ulcers in the mouth and throat, severe abdominal pain, fever, vomiting, and bloody diarrhea. Third, there's the inhalation anthrax, the rarest and most deadly form. Spores inhaled through the nose can remain dormant before infecting the lungs, causing coughing, fever, vomiting, sepsis, and meningitis. Without treatment, lung anthrax can kill up to 90% of the patients. Even with treatment, the fatality rate is around 50%. When an infected cow or goat is slaughtered, anthrax spores can spread through contact, inhalation, or ingestion. Anyone handling or eating that meat is at risk. This is why consuming red meat in affected regions is risky unless it comes from a healthy, certified animal. Only meat sold by licensed butchers who follow veterinary inspections and health protocols should be eaten. In areas not yet affected, meat from locally raised animals remains safe, but as long as it isn't imported from infected districts and is handled with proper hygiene. Anthrax spores are incredibly resilient. As few as 10 spores can cause infection, a few thousand can be fatal. In Europe and North America, widespread livestock vaccination has nearly eradicated the disease. But in South Asia and Africa, the risk remains high. Large livestock populations, limited vaccination coverage, and lack of public awareness make outbreaks common. In Bangladesh, the illegal sale of meat from sick animals, often done to avoid financial loss, continues to fuel transmission. The fatality rate depends on the form of the infection. For cutaneous anthrax, the death rate is about 10 to 20% without treatment, around 2% with early antibiotics. For gastrointestinal anthrax, it is 25 to 60% without treatment, 10 to 20% with treatment. And for inhalation anthrax, the fatality rate is up to 90% without treatment, 40 to 50% even with care. Preventing anthrax starts with safe meat practices. All cattle and goats intended for slaughter must be examined by veterinarians. Imported livestock should be quarantined and tested. Sick or infected animals should be isolated. If they die, their carcasses must be sealed in airtight plastic and buried 6 feet underground, along with contaminated soil, fodder, and waste. Protective gear, such as gloves, boots, and aprons, must be worn when handling animals or cleaning sheds. Contaminated areas should be disinfected with formaldehyde or bleaching agents. Authorities must enforce slaughterhouse inspection and restrict meat sales to licensed vendors. Early detection is crucial. Suspected cases should be tested immediately. Treatment includes intravenous or oral antibiotics, depending on the severity. All clothing, tools, and materials exposed to the infection should be burned or disinfected to prevent further spread. Animal vaccination is the most effective defense. Bangladesh produces anthrax vaccine for livestock through the Livestock Research Institute in Dhaka, though coverage is still limited. No human vaccine is currently used here, but vaccines exist globally for those in high-risk occupations, such as tannery workers or veterinarians. Bangladesh's long-term challenge lies in antibiotic resistance, caused by years of unregulated drug use. This means even proven treatments may fail in some cases. Low immunization coverage, shortage of trained veterinarians, and poor public awareness deepen the risk. Experts stress the need for long-term planning, widespread livestock vaccination, strict meat inspection, and public education. For now, medical teams should be deployed in affected areas, rapid testing ensured, and essential drugs stocked. Anthrax might not spread from person to person, but negligence spreads faster than any microbe. If action is delayed, Bangladesh could face another outbreak far harder to contain. Anthrax has survived thousands of years by waiting in silence, in soil, in spores, and in our neglect. Whether it spreads again depends not on the bacteria, but on us.